fright. Something scares you.
Yeah.
Oh yeah.
Fright is the British term for
And then you can start a horror movie something.
What?
Horror movie something, ghost movies.
So this is like sudden.
So this is sometimes, listen, this time hiccup in India, they having many people issues. This is sometimes happen due to the muscular weakness also. Okay?
The hiccup.
Or eating too fast, no? You take in more gas.
Fasting also there.
Fasting?
I know that.
Fasting you more gas, there is more
Oh yeah, the acid needs food
I
to
know,
digest.
right? He was admitted in the hospital because his hiccups when stopping for the 3 days.
How many days?
Poor guy.
hiccup problem in India is very
Common.
common.
I get it if I eat too fast. I get hiccups. If I eat too fast, I get hiccups.
Which muscular weakness?
Big gas.
When there is hiccup, there is sometimes muscular weakness. Your stomach is become the weak, that time also happen. Okay? We do the simple protocol. For example, when we are doing diamine help a lot to clean your stomach, because what we are doing, we are stimulating this all abdominal area. तो भाई चेयर लेना, बेड तोड़ेगा तो बेड ऑलरेडी टूटा हुआ है. Okay, when we are giving the treatment, like diamine is stimulating your all organ and the muscles of your abdominal, and we are targeting these 2 needle. This 2 needle is for stomach. Means the diamine means we are circulating the gas and acid in all over your GI tract. We are circulating
The gas.
acid and gas in all over your GI tract. Okay, so there is two. We will count the 2 symptoms for you. If there is a crack, okay, if there is a crack on the central tongue, you can use diamine. Okay, if diamine is very big protocol, if you don't want to use that big protocol, then you can just use these 2 points, REN 10 and REN 12. REN 10, REN 12. REN 10 is the move point of your duodenum.
Duodenum.
Duodenum. How is it pronounced?
Duodenum.
Duodenum. Duodenum. Okay, what do you want to say there? Say that again.
From the pen came.
This is the duodenum. Can you see this area?
Duodenum.
Duodenum.
We can call it duodenum.
Okay.
Okay, God, whatever you want.
You understand, no?
Yeah.
That's enough.
You are talking about the jejunum. Then it starts. Then it starts. First jejunum, then it goes to jejunum.
Okay.
Yeah. Right. It's a part of small intestine.
Yeah.
If we put, when we put diamine and we put 2 needles on the stomach, 11 and 12, that is also for the stomach only. Then if you said no, we can't, we put electrode on diamine, that time we can't put any needle extra. That's in the protocol.
अरे बाबा डायमाइन में ये तो प्रोटोकॉल है ना.
3 नीडल भी डालते हैं ना, आपने बोला ना कभी 11, 12, 13 भी
Yeah.
डाल सकते हैं.
So-
तो अब अगर डायमंड में अगर हमको लगाना है तो एक और नीडल कहाँ से लाएंगे?
क्या लगाना है? वहाँ पे 3 नीडल है, 2 पे इलेक्ट्रोड लगा, 1 और रहने देना.
तो फिर उधर गैस नहीं हो जाएगी.
अरे
बोला
बाबा.
था कि एक नीडल नहीं लगाएंगे तो गैस.
मैं बोला, if you are inserting the diamine protocol, it is far away from your abdominal. If you are inserting needle here or here during the diamine, then the gas will move toward of that needle. And she is saying like this: when you are inserting the diamine, that if by chance we insert 3 needle here, okay, we give the 2 needle like electrode, then all gas will come to this needle, which we are not giving the electrode. महान है
But you only put 2.
What's
Okay, so that's why you just put the 2 needle only, okay?
10 and 12.
Yeah, the before actually diamine protocol was only this. Okay, this is actually diamine meridian. You see that we have the 14 meridian. and there is 8 extraordinary meridian. Okay, that 8 meridian comes on that same 14 meridian. The point is not separate. The liver point is the liver meridian, right? Gallbladder point comes under the gallbladder meridian. But they design circulatory around the circulatory fascia and around some meridians on crisscross fascia. The point are the same, but they designed new path. So Dymai protocol was only these, and then slowly we did little bit more research and find out Dymai is working only on the acids and gas. Dymai playing the big role on acids and gas. Then stomach is playing very big role for the acid and gas, because what we have in the stomach, that is gastric acid, right?
Yeah.
Then we start to inserting, and all the patients who's having the symptom which is related to Dymai protocol, they having issues in the stomach. Then we start to inserting 2-3 needle here, okay, and then when give the electro, the patients get 10-20% extra result. Okay, so after that, so this is not only 3 point is fixed point. Sometime when you check the point, this point is not like fixed point. From the navel, when we do the tumor abdominal diagnosis, from the navel until the sternum, where you feel the more steep area. Okay, we'll insert needle there.
But you don't apply electricity.
Yeah, of course we apply electricity. Yeah.
So
Yeah,
you
we apply
don't have to
electricity.
do one tune or whatever. It's better to just see where it's.
Yeah, so this is the fixed protocol.
Yeah.
But this one, where you feel the more stiff, just insert on that area and give the electro with the same protocol.
Okay.
Okay, so
You
that
will
helps.
never apply moxa in that.
No, Dymai because already gas and acids.
Yes.
Yeah.
Okay, so that's why we apply on the movement to move that gas and acids.
Can you put 4 needles there?
I have never tried. You can put in this area. You can put, but that again the point is same. Too much needle, because there is only 2 again. The one is sternum and duodenum. So we insert one on the duodenum, one on the stomach.
Okay.
So that's enough to circulate. So sometimes we use little bit one needle above here. That is for the stomach wall. What we call it?
Duodenum.
No, here there is one more.
Cardiac sensor.
Cardiac
Cardiac.
sphincter.
We use for that because of sometimes that muscle become the weak. No, that time
Yeah.
also people having the acidity
reflux.
and hiccup and this all.
Yeah.
So acupuncture having very good result for that too.
Okay.
In these needles, you put it superficial. You don't need to target any muscle, or you go deep. To feel
yeah,
the
for-
organ, or you go superficial because it's acupuncture.
For Dymai, this needle,
Ren 12.
we use the same needle. What we are going to use here, we will use exactly same.
40.
Yeah, mostly for Dymai I suggest a 40 size needle because on the fat, on the abdomen we have the thick layer of the fat. Okay.
You won't just punch you just wanna stimulate the fat. You don't wanna go through the muscle.
No, we will not touch the organ. Okay, that's why I said if person is little bit obese, you can use the 40 size needle. But patient not that much obese, then you can use just 25 needle. But mostly I suggest for skinny people, I don't suggest to do more Dymai. Only in 2-3 conditions. When tongue is black on the side, only in that condition I suggest to go and do Dymai. Otherwise, we have a different protocol because Dymai is functioning, affecting more on the fat. Okay.
So when there is more acidity and gas, the tongue get black.
Yeah, so whenever there is tongue become black, when we come on the color, no? So in this condition, the side of the tongue, there is one psoriasis patient, if you know. If you see his tongue is all black side, both side tongue is black. In that condition, if patient is skinny or fatty, no problem, we use Dymai. Okay? Otherwise, mostly we use Dymai only for little bit obese people. Then that's more effective. Okay?
Is Ren
That psoriasis person, we only give Dymai from nothing else.
Mostly the origin treatment is very good. Okay? But maybe when you will learn next week, you can start the treatment. When I'm alone, it's very difficult to give you origin treatment because on the one patient, it takes 45 minutes to 1 hour time. Okay? So I can't do that.
For origin.
Yeah.
Without origin also there is a lot of effect.
When you're only doing without the original.
Mostly the solid organ, we follow more origin treatment. Origin means what we check through pulses. That treatment,
Root cause.
the root cause.
But by only doing the orthopedic and tongue, can you target 80%?
In which conditions? For what we are talking about?
Without doing the origin. You're just doing the orthopedic
Yeah,
and tongue.
yeah, you can do
Using
some.
what is the root?
Yeah, if some chronic case, then sometimes we need origin treatment. Otherwise, mostly like acidity, gastric, and all the young organ, maximum time we can fix through only pathological treatment, and the maximum heal also. But if heal become little bit chronic, then we need support from origin.
Is REN 12 the cardiac sphincter?
No, it's tongue.
Or is REN 11 the cardiac sphincter?
No, it's hard.
But how would you target the cardiac sphincter? By putting which point?
That is your RAN 14.
14.
RAN 14.
Just below the sternum.
What was it after?
The cardiac
Cardiac
muscle.
sphincter.
When we
So,
go on
if you
the
have a lot of
14,
acid reflux and stuff,
it
the
will not affect
cardiac
the
sphincter
emotions.
is contracted a lot. So to
Which
relax it,
emotions?
you would target the REN 14.
But that was only sometimes a little bit of the trying to happen.
You say that REN 10 is a move point for duoden? You say that REN 10 is a move point for duoden?
Move point for duodenum.
And REN 12?
RAN 12 is move point for your stomach. Okay.
When we put deeply between 14 and it is very painful. You can't bear the pain.
It all depends on your how we insert the needle.
No,
When
very
When
more
11?
deep. That time,
Why not go too deep? When it goes very deep, when we are inserting, see,
I don't know.
when we insert the needle on the RAN meridian, try to go little bit deep. Where you feel the stiffness, just stop the needle there. Do not cross that stiffness.
REN 11?
Any from the RAN 8 like this,
What
between this.
is it? What point is it for? What organ?
That is just extra point between these two to stimulate the upper part of your duodenum.
Okay.
Okay. So whenever inserting needle on the RAN meridian, especially between the your sternum and navel, going the deep, some point will come there. You will feel mild steep. Needle will be steep. So do not cross that steepness.
And then
Just
you can
leave the
reach
needle.
Yeah, just leave the needle, or you can take out mild needle outside that steepness and give this stimulations on there only. Okay, when we insert the needle, then one point will comes that is like boundary of your your organ muscles and fat. That stiffness
stiffness.
means you almost cross the wall fat, and now you are going to touch the organ.
And you don't want that.
Okay, yeah, so do not cross that one, just come a little bit out and give the electrode. Okay,
Origin treatment and
we'll do the treatment through the pulse diagnosis. Okay, third week, fourth week, we'll learn only that. So we'll do the pulse diagnosis and treatment according to that.
That's the root cause.
Okay, what we'll use for this? For the stomach, for example, if you are not going to use diamine, just use this two needle. Which one?
REN 10.
RAN 10 and
12.
12, and use two more needle. Which one?
Liver 30. Liver 3.
Stomach 36
ST36.
is a kapha point for your stomach.
Oh.
Stomach 36 is the kapha point for the yeah. And the stomach 44.
Where will you show the meridian of the stomach? Just
That we'll discuss with origin treatment. Okay. So this is the stomach 44.
the right side. Is there two of them? or it's just the right
So
side?
this stomach meridian is ending here in this finger. So this is stomach 44.
So this
It
will
is
be
coming down like this.
this stomach 45.
The right side. Stomach 44.
क्या बोलते हैं इधर जाएगा या फिर इस साइड से आएगा? मतलब
इधर जाएगा.
एग्जैक्टली बीच में इन दोनों के बीच में ही डालना है.
On the left side, is it?
We should discuss now stomach in right side.
You are making
Okay.
36 is the upper point. Ren 10, Ren 12, ST 36, ST 44. Okay?
Maybe you say when you don't want to use dynamite, you do these points. For example, because before you say that for people who are very skinny, you avoid to use dynamite for them, except in 2-3 cases you use dynamite.
Yeah.
So that could be something good for very skinny people. This treatment.
Yeah, this treatment is very good for those people.
That means you use 4 points.
Yeah, only 4 points. So sometimes, for example, patients don't have too much problem, just mild acidity in the stomach and bloating here in the stomach. Okay. In this condition, we don't need to use the full protocol on tongue. There is not many symptoms, just mild crack. So in this condition, just insert 2 needle here and 2 needle there. Stomach 44, stomach 36, and 11 and 12. Sorry, 10 and 12. This is enough. And always remember, for the skinny people, we avoid the electrode on the abdominal and this sort of area. Okay.
When we put these points, we have to do moksha or we have to do yoga.
Just leave it. That's okay. If you want to give moksha, you can give.
इधर गैस नहीं होगी. मतलब अगर गैस नहीं अगर मोksha लेते हैं तो you just gas.
Stomach पे जब केवल stomach पे करेंगे तो नहीं होगी. One of the best thing in this treatment, if you want to give the moksha, then if you give only 1 point moksha, stomach 36, that will be enough.
So where should we use moksha?
But you say that we don't use
And
moxa
that's
for
like-
stomach problem because there is too much gas.
If you use stomach 36, no,
Is this type one?
that's the very effective point. Okay. And for the crack, if you want to use very superficial light moksha, okay, we don't give the moksha. For example, sometimes in some conditions we give the moksha on the stomach, okay, but very light and superficially. How we insert the needle? Light and superficially. For the kapha, we give the long time moksha and the deep moksha.
But for dryness, only little bit.
That we are just stimulating. We are not going to. We are just giving the signal through the moksha. We are not giving the heat too much. Because in this condition we can't give the electricity, no? If there is no fat, we can't give more electricity. And the patient is more skinny, you cannot stimulate through your hand. That's very painful. Okay? So try to give just sensation, do not give the heat. Try to give just sensation through the moksha. Understand? And stomach 36, you can give the more deep heat. Stomach 36 is very good to open the blockage from the stomach.
And you can put salt or anything on the navel or no.
Salt is common, like when you are eating, you are putting the salt on the navel, that means you are releasing the whole abdominal fascia. So there is no restriction for what case you can give salt or what case not give. Salt is balancing your vata pitta kapha 3 and releasing your 3 layer of the fascia in the abdominal region. Okay, so on the navel salt you can give to anyone. The front tip of the tongue will become the crack. The tip of the tongue become the crack.